Hello, everyone. This video is about the adductor group. The adductor group is on page 319 in your book, and it includes adductor magnus, adductor longus, adductor brevis, gracilis, and pectineus. So let's get started. All right. Move this out of the way for a second. There we are. Okay, so again, page 319 in your book, we have the 5 adductor muscles. The adductor group lies along the medial thigh and forms that big wad of muscle that runs the length of the inner thigh there, okay? Their tendons attach kind of all over the place, but mostly they run from the ischial tuberosity, ramus of the ischium pubis area, all the way down to the medial thigh at the knee, and occasionally past the knee down to the tibia. So it's a pretty extensive group. Pardon me. So the book gives you all of the actions at once, and I don't really care for that. I think it's extremely confusing. So what I recommend as we go along through this video is that you write down the origin, insertion, and action for each individual muscle. You can even write it in your book, or you can write it, in your notes or something like that, but this is really confusing. So as we go, we will do origin, insertion, and action just to keep everything compartmentalized. All right, so here is the adductor group. As I mentioned, they form that large wad of muscle on the medial thigh. It's all the medial thigh pretty much. And if we take a look at an anterior view here, they actually form quite a bit of the thigh muscle itself. So here we have pectineus, which means comb-like, by the way. We have adductor brevis. It is shorter than adductor longus, as you might imagine. We have adductor magnus, which is the biggest one. Adductor magnus is the floor of the adductor. So it's the most posterior one, and it's also the biggest. And then we have gracilis. Gracilis is a long, slender muscle that runs the entire length of the medial thigh. And gracilis means graceful, slender. See, down here you can see the meanings. And they all come from Latin. Okay, so let's start talking a little bit about each one. And this is page 320, 321, etc. Okay, so adductor magnus, as I mentioned, is the floor of the adductors. And here it is. Adductor magnus. See, you could, from the anterior and from the posterior, it is just a large muscle. It covers almost the entire femur. It covers a good bit of the ischium. Okay, back here, there's the ischial tuberosity. But interestingly, one of the features of adductor magnus is this structure right here. It's called the adductor hiatus. And hiatus means break. So this adductor muscle actually kind of has a hole right through it. Now, it's intentional, of course. Nerves and blood vessels pass through here. So if you can see, I will just kind of outline this. This is the adductor hiatus right there. And of course, the same thing on the other side. This is an endangerment area. It's one of the few endangerment areas that we have that's not associated with a joint. And again, it's because nerves and blood vessels and things run through there that we are not going to put a whole lot of pressure on the distal medial thigh. We wouldn't really anyway, just because it's kind of a sensitive area, but part of its sensitivity is the fact that there are nerves there at the adductor hiatus. So I wanted to make sure that you saw that and pay attention to it for palpation. Okay, so adductor magnus originates on the inferior ramus of the pubis, the ramus of the ischium, and the ischial tuberosity. So we're talking about this whole area. So here's the ischial tuberosity, ramus of the ischium, inferior ramus of the pubis. And you can see that. Unfortunately, I have to keep scrolling up and down, but there it is, right? That whole area right there is the origin, which means that all of this is going to be the insertion. So let's see what we have here. Medial lip of the linea aspera. Remember, I said we are going to be using those. Yes, indeed. So medial lip of the linea aspera. So here's the head of the femur, which makes this right here. You can see the shadows. This right here is the medial lip of the linea aspera. Okay. So that's what we're talking about in terms of insertion, medial lip of the linea aspera, and then the adductor tubercle. Remember, yeah, remember, we have this, and of course I have to turn it around because it's actually easier to see from the anterior. We have this little bit right here. It's a little bit raised and roughened, okay? And I know the light's shining on it and it's hard to see. That's the adductor tubercle, of course. So we have medial lip of the linea aspera and adductor tubercle. And it's because of that adductor hiatus. So you can see medial lip of the linea aspera here. And then it skips and then inserts on the adductor tubercle. Okay, so as far as actions are concerned, we have to remember that the insertion moves towards the origin. So we are going to be moving the hip, of course, and the muscles are going to be contracting in this direction, right? We're moving the origin toward the insertion. So I draw these arrows so that you can sort of visualize how the muscle is shortening. Okay, so the actions. Now we have to go back to that first page, page 319, right there, where it says that all of the adductors adduct. Yes, I mean, it's in the name of the group. All of the adductors adduct the hip. So adductor magnus is no exception. Adductor magnus adducts the hip, okay? But because, well, hold on one second. All the adductors adduct and medially rotate the hip. I don't want to forget that before I move on. All of the adductors adduct and medially rotate the hip. So adductor magnus adducts and medially rotates the hip. But because it is so far posterior, we have a posterior type action for adductor magnus. It is extension of the hip, okay? Extension of the hip. So these posterior fibers, the ones that I have the arrows on, I guess I'll clear those off. Those fibers can extend the hip. But the anterior fibers here flex the hip. So for adductor magnus, we have adduction of the hip, medial rotation of the hip. I'm looking at the book so I can put little bullet points next to adductor magnus. Flex the hip or assist to flex the hip. You have to understand that the adductors are not strong flexors. We will get to the really strong flexors in this unit. Adductors assist to flex, okay? So adductor magnus assists to flex the hip. And The posterior fibers of the adductors extend the hip. So you had 4 actions for adductor magnus. So if you're a visual learner, you want to put your bullet points, you just draw, okay, 1, 2, 3, 4. I have 4 actions for adductor magnus, and you can go ahead and fill those in, okay? All right. So that's adductor magnus, the floor of the adductors. So the other 2 we have with adductor in the name, of course, are adductor longus and adductor brevis. And of course, we're talking about adduction, adduction. Adductor longus and brevis, they sit right next to each other. And in fact, adductor longus covers adductor brevis a little bit. But they have kind of similar attachments. So adductor longus originates on the pubic tubercle. So that's right here. Right, there's the pubic tubercle. And inserts then on the pectineal line and medial lip of the linea aspera. Pectineal line and medial lip of the linea aspera. Okay. We'll go with that. It is a little bit low for the pectineal line, but that's okay. It's what the book says, so that's what we'll go with. Pectineal line and medial lip of the linea aspera. So right here. And of course, this is an anterior view, so we're really looking through the bone to the posterior view, medial lip of the linea aspera. Okay, so adductor longus actions. Remember, all of the adductors adduct and medially rotate the hip. And all of the adductors also assist to flex the hip. Okay, so that's it. Adduct, medially rotate, and assist to flex the hip for adductor longus. So 3 actions for that one. I'll clear my drawings here. Now, adductor brevis, obviously it's a lot smaller. It's short, it's squat. Little adductor brevis. Adductor brevis originates on the inferior ramus of the pubis, right here. And then inserts on the pectineal line and medial lip of the linea aspera. So this is where the overlap happens for adductor brevis and longus. Okay, so this one is more pectineal line and medial lip of the linea aspera. But that's okay. Adductor longus and brevis are right next to each other. They overlap a tiny bit. Their actions are the same. So they are synergists. They adduct the hip, medially rotate the hip, and that's right, assist to flex the hip. Good. Okay, so these 2, same insertion. It's a good thing to remember. It's easier to learn when you have things that are the same. Okay. All right, so those are the 3 muscles with adductor in their name. We also have pectineus and then gracilis. So pectineus and gracilis are adductors. Pectineus is similar to adductor longus and brevis, but gracilis is kind of different. So let's go on to the next page here. All right, so when we're talking about insertions, you see how close together they are for all of these adductors? They're pretty much all along the medial lip of the linea aspera. That makes sense because they're all going to adduct. So they're all going to pull the thigh towards the midline of the body. All right, so pectineus originates at the superior ramus of the pubis. So it's way up there. And then, of course, it has its own insertion, pectineal line of the femur. So right about here, remember way up there is the pectineal line. So it's right here. Okay. Just inferior to the lesser trochanter of the femur is the pectineal line right there. Okay, so that's kind of nice. The pectineus has its own insertion, pectineal line. It was like the deltoid, inserting on the deltoid tuberosity. Love it. Pectineus is like adductor longus and adductor brevis. It adducts, medially rotates, and assists to flex the hip. Pectineus is actually the groin muscle. So when somebody pulls their groin, like they accidentally do a split, and that happens on occasion, or they fall and they have a high adductor strain, they'll say, I pulled my groin, or I pulled a groin, or something like that. Well, pectineus is considered the groin. And if somebody does have a groin injury or high adductor strain, you may need to work, high up in the adductor area. So we'll really have to pay attention to our draping when we're working in this area. Gracilis. Gracilis is that long, slender muscle that is right along the midline of the body. Gracilis is a different adductor because it is on the midline. So it's going to do some different actions. The other thing about gracilis is that it crosses the knee like that. So here's the insertion of gracilis. It's the only one of the adductors that crosses the knee. So if it crosses a joint, it has to have an action at that joint. Gracilis is no exception. Gracilis is going to do something to the knee. We'll talk about that in a second. All right, so as far as origin is concerned, we have the inferior ramus of the pubis, which is not shown here, but that's okay. The inferior ramus of the pubis is shown on page 320, so you'd have to back up a little bit. Or if you have your book open, you can see all of, there we go. You can see all of the origins along the coxal bone here. So this one's pectineus, right? Superior ramus of the pubis here. Then of course, adductor longus, brevis. Gracilis is right here, okay? And I like the way that they have this cut over here where you can actually see how the tendons sort of interlock with one another for the adductors. Okay, so gracilis would be right here, the origin of gracilis. Pardon me. Now, the insertion is the proximal medial shaft of the tibia at the pes anserinus tendon. Okay, there are 3 muscles that insert on the pes anserinus tendon. This is the first of the 3 that we will discuss. So you can write this all out, proximal medial shaft of the tibia at pes anserinus tendon, or if you like simplicity, you can just write pes anserinus. Pes anserinus actually means goose foot. And right now that doesn't mean anything to you because you can't see the actual pes anserinus tendon here, but it does kind of look, it looks a little like this. So it does kind of look like a webbed foot at the tibia here. So that's what it is. Pes anserinus means goose foot. Okay, so as far as the actions for gracilis are concerned, these are a bit different, as I mentioned, because 1, it crosses 2 joints, and 2, it's directly on the midline of the body. So this is different. All of the adductors, right, adduct the hip. Gracilis does too. All of the adductors medially rotate the hip. Gracilis does too. Okay, now here's where we vary. Gracilis does not assist to flex the hip. Gracilis flexes the knee instead. Okay, it's along the midline. So it can't really pull the hip back or forward into anterior posterior position just because of its position directly on the midline. But what it can do is affect the knee. So it is going to flex the knee and medially rotate the flexed knee. Now, medial rotation of the flexed knee is very difficult for me to show you because it's not a big movement. Let me see if I can bring him out here. Whoa. Yes, I will hit myself with this one day. Okay, so here's a flexed knee. So here's the femur, here's the tibia, and of course there's not this much space between, there's just like a big bolt here. So medial rotation of the flexed knee looks like this. Okay. So the tibia actually moves into a bit of rotation. Now, it doesn't rotate a lot because you have, you specifically have ligaments within the structure of the knee that prevent that from happening to excess. But there is a little bit of play with the flexed knee. So flexion of the knee and medial rotation of the flexed knee are also actions of gracilis. So let's take a look at these adductors on the visible body here. Here is adductor magnus. I'll make this just a little bit bigger for you. And you can clearly see the adductor hiatus here. This long, slender one right here, that's gracilis. As you can see, it is very slender and very long. And if I back out, you can see there's the pes anserinus right here. Okay. Now, what we don't have, actually we do. Let me get rid of that. I'm just gonna hide it. That's confusing because that's all. I'm gonna hide this one too. Hide sartorius. Whoa, Nelly. Show others what just happened here. Gonna hide all of the quadriceps because we don't need to see those, right? Okay. So let's turn this guy around here. There's vastus lateralis. I just left him in there. And the hamstring group, I left him in there too. Look at the back of adductor magnus. So I'm going to hide adductor magnus for a second so we can see the others. So here's pectineus, here's adductor brevis, and there's adductor longus. And again, if I spin them around, you can see that there was some overlap. Pectineus, adductor longus, where's adductor brevis? Well, it's back here, okay? So they all fit together very closely, very tight. Now, if you go into, let's stop share for a second. Actually, no. I'm going to go into lesson content. So if you go into your lesson content as you're following along, checking things off the checklist, right? We have visible body, gluteals, iliopsoas, deep rotators, and adductors. So this is what I clicked on to get to here, okay? You click on that link and then you choose medial thigh compartment, and then you can follow along. You can play with this, you can hide some, you can show others, and you can look, fade all the rest and just look at one muscle at a time. You can get more information about that particular muscle, okay? And of course, you can rotate this all in 3D. Now, I have a touchscreen computer, so if I'm using my mouse, I just hold the right button in and use my cursor to move everything around, okay? Okay, that's it for the adductor muscles. Remember, there are 5 adductor muscles, and all of them have the same actions in adduction of the hip, medial rotation of the hip. Remember, gracilis is that wild card, so it doesn't play quite the same way as the others do. So just keep that in mind when you're studying these 5, okay? All right, see you soon.